Well, an epidural steroid injection is a procedure where we inject steroids and usually some lidocaine into the space that surrounds where the spinal nerve roots live, called the thecal sac. And those steroids decrease the inflammation that always goes along with degenerative disc disease. And when that inflammation is decreased, the pain is improved. And so we try to give people at least some relief that will allow them to then heal themselves and hopefully put off surgery at least as long as they can. People with back pain, those with back pain that's radiating into their legs, those people with spinal stenosis where the spinal canal is narrow, secondary arthritis, and so on. And most of the people we do both in the back and in the neck get some relief. Well, what they do is they decrease the inflammatory response, which is related to degenerative disc disease, and they decrease that inflammation and therefore decrease the pain. Lots of times we'll see people who have a bulging disc and are in pain and have symptoms that include back pain and pain down one or both legs, and we can inject some steroids close to the source of that pain generator, which in this case is the disc, and get them relief from the pain. Some people get relief fairly quickly, and 80 to 90%. Others maybe 60 to 75%, and it'll usually last for anywhere from a few months to, I've done people a couple of years apart. Sure, you can eat the night before. The only preparation, there's really not much preparation. The only thing I ask is that after we do the procedure, that you go home and either sit in a recliner so your low back is the closest thing to the ground, or just lay in bed for a few hours. I tell people it doesn't work, it doesn't hurt any more than going to the dentist. It's usually a little bit of a pin prick to numb them up, and the rest of it is usually pretty painless. Well, basically anybody with an MD license, but typically I'm biased obviously, but the radiologists, especially those who specialize in neuroradiology, radiology of the spine and central nervous system, we do these procedures all the time. We interpret MRI and CT scans, and so we kind of feel like we have a leg up on knowing what we're looking at. There's a theoretic risk of infection or bleeding or allergy. We're very careful to make sure that patients are not on blood thinners, don't have any major allergies to any of the medicines we use, but beyond that, it's very, very safe.